Georgia's Medicaid and Peach Care programs provide life-saving healthcare coverage and support household financial security for about 2 million Georgians, which is about 1 in every 5 people in our state. Medicaid pays for services across the lifespan. So, for example, here in Georgia, Medicaid finances about 45% of all births and 72% of nursing home stays. It helps people afford to see the doctor, fill prescriptions, get access to preventive care, and much more. Although Georgia's Medicaid and Peach Care programs are jointly funded by the state and federal government, the state administers the program. Georgia has some flexibility to determine what populations and services to cover, how to deliver care, and how much to reimburse providers. Georgia can and has obtained federal approval to test and implement approaches that differ from what is required by federal law. So, a key component of Medicaid and Peach Care eligibility is annual household income, and the program is primarily intended to cover Georgians with lower incomes. Other key eligibility criteria include age, disability status, and citizenship status. Low-income Medicaid serves children, pregnant and postpartum people, and some parents with very low incomes. The age, blind, and disabled portion of the program serves older adults with low incomes and people with certain physical and developmental disabilities. Peach Care is a separate program serving children from families with incomes above the Medicaid threshold, but who often lack access to other forms of health insurance. Finally, the Pathways to Coverage program is a new Medicaid option that provides coverage to low-income adults who can meet a work reporting requirement. Some groups are overrepresented in Georgia's Medicaid and Peach Care programs. Because of the limited eligibility criteria for adults, children actually make up most of Georgia's Medicaid and Peach Care enrollees. Long-standing discriminatory policies and practices like regressive tax policies and occupational segregation have created unequal access to economic opportunity for Georgians of color. As such, Black and Latino Georgians are more likely to be in job sectors without access to employer-sponsored coverage for themselves and their families compared to white Georgians. And they are thus overrepresented in the Medicaid program. Similarly, rural counties in Georgia tend to have a higher proportion of residents enrolled in Medicaid, due in part to less access to jobs that offer employer-sponsored coverage and higher rates of poverty compared to their non-rural counterparts.